what is the 3 most important features in getting a good whitening result?
Number 1, because...
Is it true that patients should try a white diet when having treatment?
I heard of that when I was started bleaching 30 years ago. Because I don't have to drill anymore, just I can't do internal my bleaching. Is this because I give myself restriction? I have no drills in my clinic. If you got a good protocol, it works. Like I can show you some cases, just 2 weeks. It's amazing result we get from a C4 to B1, just 2 weeks.
2 weeks
2 weeks.
for tetracycline saline.
Yeah, this is a colorless plaque indicator. Remove plaque at the same time. Also reduces gingival inflammation. They say we have nothing like that.
Is this solution a substitute for mechanical plaque removal?
It is a substitute for mechanical cleaning. To me, there's no need to do polishing anymore.
Protrusive, we have got the Wyman Chan. I don't know how I pull this off. This is the guy who I've been watching in the whitening space for so many years. And actually, he kind of disappeared. Where did Wyman Chan go? Was on the lips of every UK dentist for so many years. But guess what? He's back! All right, let me tell you about Wyman Chan. This guy hangs up his drills in 2002 to solely focus on teeth whitening. That's it. Imagine that, right? At a time where teeth whitening wasn't even like a proper thing. So since then, he's been like whitening the teeth of celebrities, and all the famous people will go to a central London clinic, get their teeth whitened by him using his formulas, his patented technology, and his knowledge. Like, he's a PhD, and he's so passionate about teeth whitening. The guy's done over 20,000 whitening cases. I was actually thinking, I don't even think I've seen 20,000 patients in general in my career so far. So that just tells you the volume of teeth whitening he's done. And he's like a mega geek. Like, what he doesn't know about whitening is not worth knowing. So we take advantage of that. I literally ask him all of your questions that you submitted on Protrusive Guidance. The usual stuff like, is the light thing, is it a fad, or is there some science behind it? Do you need to adopt a white diet 2 hours after whitening to make sure that you get a good effect from teeth whitening? Like, that's all standard. We've actually talked about it before, but we revisit it in this episode. But of course, every episode we have game changers, and there's a few game changers, about 3. Well, there's more than 3, but the 3 that are top of my mind right now while recording this introduction. One is that for non-mitral bleaching, imagine you get that black central incisor. Usually the way I would treat it is make sure that the root canal treatment is good, and then re-access the access cavity, of course, and place my gel inside and whiten from inside and also outside. Now, what Wyman Chan discusses is a protocol of not doing the internal part of non-mitral bleaching, doing it externally only, which is very fascinating. The other cool thing he teaches in this episode is this concept of conscious bleaching, which I'd never come across before, but it makes so much sense. It is the number 1 thing that reduces and eliminates sensitivity, and I'm a little bit upset that no one told me before. It just makes so much sense. I can't wait for you to listen to this episode and learn about what is conscious bleaching. And the final game changer is today's Protrusive Pearl. Hello, Protrusive. I'm Jazz Galati. In every PDP episode, we give you a protrusive dental pearl. Something to reflect on, something to digest, something to apply to your patients right away. We have all sorts on here, and today's pearl is about innovation. Wyman Chan is just like this awesome guy in whitening, and he has got so many patents. I didn't even know about this. And one new invention he's come up with is called Magic 3. So remember I said that Wyman Chan went missing? What I meant is he went to China, okay? He went to Asia, developed a whole bunch of things and protocols, and does loads of teaching there. And he's launched some products there as well as in Dubai, and now he's bringing Magic 3 to the UK. And so in a nutshell, because I don't want to take up too much time here, I really want you to listen to this episode. But essentially, Magic 3 is this like colorless gel. It's this clear gel that you put on the teeth, and then if there's plaque anywhere, it will start fizzing. So they call it a colorless plaque indicator, which sounded really crazy to me. I still can't get my head around it, and the way I understood it and seeing the product myself, it just fizzes when there's plaque. So it is indeed a plaque indicator in that way. You're looking for fizzing. What it does is it cleans the teeth. It replaces your polishing stage. For many patients, it replaces your scaling stage. So if these are regular patients that you're seeing every 6 months in hygiene, and they haven't got like mountains of this hard calculus, then this gel actually replaces your hygiene work. And the reason why that piqued my interest is because I get patients coming to me all the time, and they say they just don't like the ultrasonic scaler. And my poor hygienists that I work with, they get frustrated because that's how they were trained. They want to use the ultrasonic scaler, the P-Zone. They want to get in there and clean. But these sort of subset of patients, they just don't like it. They come from a generation of being used to hand scales like 30 years ago, and they want that again. So it was like a penny drop moment for me when I thought, okay, so actually what Wyman Chan is showing on the website for Magic 3 is that it's good for nervous patients who don't want that feeling of having a scale. It's good for children because you can actually use it on age 6 and above because it's a class 1 medical device. You can use it for anyone who just doesn't like the feeling of the scaler. I personally don't even like the feeling of the ultrasonic scaler. And you can use it on orthodontic patients in the prevention of white spot lesions. So any orthodontic practice, any hygienist working in orthodontic practice, this is something really worth paying attention to, because to me it becomes like a kind of business model and a model of how you work your practice, a practice philosophy. So for example, I've worked in clinics that have adopted the EMS airflow model. So every hygiene chair has got this EMS airflow and they all get airflow, and it's a set protocol that you do. You disclose the teeth and then you blast it all away, and a lot of patients like it, some don't, but the whole experience of the airflow, a lot of patients end up loving it. Now of course there's upsides and downsides to that. Quite often I've seen on the WhatsApp groups that the machine's having issues, they have to repair it and service it, and not all patients like it, so you have to go back to your usual hand scaling. But I think the practice where I work at the moment in Reading, which I'm about to leave unfortunately, but I think that would actually work really well. So this Magic 3 treatment would be incorporated as part of the hygiene is what I'm thinking, and all patients would have it. And the way you do it, you apply it on the teeth. There's a special retractor they put on, and like one dose is applied to all the teeth surfaces, all the gingiva, and it's left for like 10 minutes, and the patient wears a mask over it. So these patients are just relaxing, there's no discomfort, there's no pain, there's no scaling, and then once it's rinsed away, all the superficial stains have gone, the teeth feel silky and super clean. These are the patient's own words. And any soft calculus has actually become even softer, so it's really easy just to pick away with the scaler, and any plaque is gone. Any gingival inflammation is starting to settle already. So I was quite amazed talking about this, so we're recording another episode just all about that, and that'll be a video only episode. Wyman Chan is literally launching this product tomorrow at the Dentistry show, so if you're listening on the published day, then literally tomorrow this product is being launched. If you want to learn more, including a special discount just for Protrusive members only, if you think that your practice hygiene model would benefit from this, or there's a certain subset of like nervous patients or children that you see that would benefit from this, then head over to protrusive.co.uk/magic3. That's protrusive.co.uk/magic3, and all the coupon code and discount details as they change month to month will be on there. Now let's join the main episode. I'll catch you in the outro. Dr. Wyman Chan, welcome to the Protrusive podcast. Niki Shah.
Thank you, Jess. Thank you.
Thanks for joining us, guys.
Well, thank you for inviting me. I'm really honored to be here. Hopefully, we can share some of the work I've done with you guys, with your community.
I'm actually like really starstruck, right? Because so the first time I ever heard about you, I was a dental student. I was at a conference, and a dentist I really respect called Zaki Kanan was doing a demo for Whitening.
Yes.
And then he was mentioning about your work. And I got like, I probably Googled you at that point. I was like, wow, he's like doing whitening for all these celebrities, okay? And so that was like, that was an amazing thing to see. And then, you know what? He told me about this technique, which apparently no one else can do because you owned it, apparently. And then we had to ask permission for you. So maybe this is myth busting or not, okay? But essentially, when you're doing whitening, to get super sealed tray, you score using the ultrasonic around the gingival margin on the models when we're using the stone models, right? And then you make the tray on that, and it has an extra seal. Then, is that true? That was stemmed from you, and then someone had to ask, like you own the patent for it, or how does that work?
I own 2 patents in the UK, just for the trays, for the tray design. Yeah, that was part of that. We have a seal. And we score the models, not with the ultrasonic scaler, with something else. But you can do that with an ultrasonic scaler as well. We use the tools, which is very how we say, it's fun. And I like to share. That's why whoever use my design, please use them. But just say that who is the inventor. I'm more than happy to share. So I'm very, very happy that Zaki actually shares my invention. Please tell.
But he did credit. He said that you to ask and credit,
Excellent,
and so that was very good of him to do that.
Yeah,
and so he did it in the proper channels. Shout out to Zaki.
But the trays are really amazing. I wish you guys just use them. Use them. It's free. Please use them.
Okay, super. Well, let's just, for those people who may not have heard of you, right? I just found out a few moments ago in the preamble that actually Dr. Chan, Niki, did you? I mean, you probably knew this already, but he hasn't done actually dentistry for many years. He's just been like some people will only do dentures, some people will niche into implants. Okay, very rare you find someone niches into teeth whitening. Absolutely. So we need to figure out what's the origins of that. So tell us about your story and origin, and then Niki, I want to ask about you as well.
Okay, I hang up my drills in year 2002. That is over 23 years ago. Because at that time in 2002, I opened a dedicated tooth whitening clinic in central London. And I was very focused. At that time, I encountered a lot of difficulties and a lot of problems, really a lot of problems.
I mean, at that time, correct me if I'm wrong, at that time, technically, teeth whitening was illegal.
Technically, it was illegal. Technically,
Did you know
whatever you do was illegal. Yeah. So we were all doing something illegal. Especially me. I have a dedicated whitening center. It was really, really high profile. It's really good that the police never locked at my door. So I was really, really grateful. But until 2012, it became legal. It was good. So why did I hang up MIDROLL? Because when I was opening the center, I was really love teeth whitening. I thought that it was such a easy way, I would say, to work. It's stress-free if you do it properly, and if you do it properly, it's no complaint. And the procedure is so simple, really simple. I mean, it's much easier than doing any form of dentistry, easier than scan and polish, in my opinion. But I encountered so many problems that our colleagues encounter now. So I use all the system probably available at that time. And then I went back to the distributor. And sometime I wanted to show, I asked the manufacturer, I say, I encountered this problem, that problem. They always come back to me, we never heard of these problems before. Must be you. And then I started forming a group with like-minded dentists who are really interested in teeth whitening as well. And we found that we're all facing the same problems. There's a denial among the manufacturers. So I have nobody to turn to. And that's why I say that, okay, I'm going to hang up my drills. I'm going to do research. That's why I'm starting research and progress to that. Actually, in order to solve the problems, I went on to do a PhD. And I got my PhD. My PhD is, the title is Safety and Efficacy of Teeth Whitening Processes.
Probably like we all reference it without knowing it. It's one of those things.
Yeah, because I encountered so many problems. So I was so lucky that in my years of research and studying my PhD.
Where did you do that? Which institution?
I did that at Bolton University, which is like a chemistry. Mainly I do a lot of chemistries. It's in the Institute of Material Science and Innovation. What a place to do it. So a lot of material science and a lot of innovation as well. So I did 5 years in Bolton, but before that I was doing a lot of research because I encountered so many problems that I could not solve. Because I committed to open a shop.
If you can spend 5 years in Bolton, there's no problem you can't solve. I mean.
Yes, yes. No, we're very lucky. I've got a good team, good supervisors, good chemistry, good. So we solve a lot of problems. So I'm happy I'm here to share with you my journey in the last 23 years, 25 years.
There's no question that you haven't encountered, and so we got like a gazillion questions from you guys, the community. You guys been voice noting me, you guys been screenshotting me, you guys been telling me on Instagram, on Protrusive Guidance, and Niki, you're the man who made it happen. Thanks for connecting us. Hold the mic and just tell us about yourself, Niki.
Okay, so I graduated in 2011 from Barts in London, actually with Dr. Sunny. Dr. Sunny and me are very, very good friends. And our stories are a little bit similar. So if people have heard, we went through the same process of hating dentistry so much, got 7-8 years in and realized, what are we going to do? We can't become a banker or something. Now we've got to do something in dentistry. That was in 2019. And I was really struggling with composite dentistry at the time. So it was been almost 2 years since I saw Dr. Sunny, went to his house and we were talking. And at that time we were listening to Dental Town podcast, Dr. Howard Farran. And there was one particular podcast by Dr. Dennis Brown in there, and the greater curve.
The famous Dr. Brown.
Famous Dr. Brown. And we just decided, we got together, we said, listen, we are struggling to get good composite, restorations. Let's just approach the team and see if we can get it into the UK, and if they're interested, we can actually teach dentists on how to use the system, because it's completely different. So we did that in 2020. The pandemic hit. It actually gave us a little bit of time to step back and actually work on the business, and Sunny is taken Dre from strength to strength. My focus was a lot on clear aligners at the time there. So what my character is like, if I feel that there's a problem in something, I try to approach who I feel is the best in the industry to solve my problems. So with the liners, I'd actually done the 6 months Smiles course there. They were great, but I didn't do many cases. As we were sort of going with Sunny and Cash Hafiz at the time there, I got introduced to two brothers from Australia, Stuart and Richard Whiteley, who developed a company called ProLiner. Very simple aligner company, used the best two materials, Zendur PET G, 7-day turnaround time, and they have a pay-as-you-go payment plan. So if you've got simple cases, £30 an aligner, £85 for treatment plans. Mm-hmm. My profitability went up. So from there, I started teaching and mentoring other dentists in clear aligners. Mm-hmm. I'm nowhere near an expert. I'm not a specialist, just a humble general dentist over the past 8 years doing clear aligners. I started finding a lot of my patients, after I'd finished clear aligner treatments, wanted teeth whitening.
I mean, something that we just throw in there, like, oh, you get whitening included.
Absolutely. It was just a free thing. Oh, here's some polar whitening. Take it with you. Do it for the next 2 weeks there. I really didn't know what I was doing. This last year, I spent quite a lot of time in Malaysia, where my wife is from, and one evening I was sitting there and I happened to see a live demonstration of Dr. Wyman Chan doing something where they were prophylactically cleaning teeth using a gel. It caught my eye, and the kind of person I am, I have to find out more. So then I actually messaged Dr. Wyman Chan's team on Facebook to say that I'm really interested in what Dr. Wyman Chan has been doing in Dubai and China. Would there be any possibility that I may be able to be in contact with him? I'm currently in Malaysia, and one of your colleagues actually mentioned that, oh, Dr. Chan is from Malaysia himself as well. Mm-hmm. And luckily put me in contact with Dr. Chan, and I got back from Malaysia about 6 weeks ago and met up with Dr. Chan, and here we are today. So that's been my journey, sort of. My family background is products and business, so it's kind of like I like to find products, bring them into the UK, and then form sort of company around it.
Perfect. Well, Niki, thanks so much for connecting us. And so very nicely from that products, right? Let's talk about products, because the one question we have in the community, Wyman, I'm sure you get this all the time, right? It's a bit like when a pharmacist gets asked, is there a difference between ibuprofen 200 milligrams versus Nurofen, the branded one, right? So in a similar vein, my question to you is, there are a gazillion brands of whitening. I once heard a rumor that all the gel is made in one factory in China, and then it either gets in a brand A, brand B, brand C, okay, like a lot of products are, okay? To what degree is that true, and to what degree does the brand matter more than the fact that it's just hydrogen peroxide or just carbamide peroxide? Is the brand actually make a difference?
See, teeth whitening is very special. To me, it's very special. It's not just the products, it's not just the brand, it's the combination of the brand, the products, and the technique.
Protocols.
Most important is the technique and the protocol and the training, because we're not taught teeth whitening in the undergraduate school. So we go out there as like a jungle, which is
Wild West.
Yeah, Wild West. We try this product, these products. I'd like to give you an example to answer your question. I love red wine. Okay, red wine, they are red in color. They all for 12.5% to 30% alcohol. They produce from many different countries. Some wine is only £2 a bottle. Some can be 20,000 pounds a bottle. Is there any difference in the wine? It depends on who's using it, who's drinking the wine. To an average person, there's absolutely no difference, because firstly, there's no training. They don't know what to look for. Number one is
how to taste it.
How to taste it. The teeth whitening as well. What to look for. What kind of things to look out for. So that is one thing that we're not taught. Similar in drinking wine. If nobody is, you haven't been to any wine courses to learn how to taste the wine, how to appreciate the wine, how the wine is made, and it's very different. That's why the French call it terroir. It's what is in the ground, what is in the soil. So it's the teeth whitening as well. It can be, let's say, 16% carbon monoxide. There's so many ways to make 16% carbon monoxide. So many ways, and so many ways to apply them, and so many ways like we can do it many different systems as well. So are they the same? Are they not the same? The chemical is the same, but the way to make it could be very different.
So really, if that's the case, then yes, where it's manufactured, how it retains its freshness, and therefore I'm hearing that the brand actually does matter. And
Yes, it does matter.
But here's the problem, Wyman, is that as dentists, we see who is the best marketer, right? We don't see who has the best manufacturing protocol, whose gel is the freshest. We go by ads and conferences and who is in our face and who gives us the first 3-5 cases. So I'm going to ask you very bluntly, in the UK or in the US and around the world, for all our listeners in Australia, around the world, which is the best brand?
There's no best brand. Yeah, not including mine. There's no best brand. I think we as a dentist, it's that like go back to the wine again. Why some people are so good, this connoisseur, it's all about practice. They drink it a lot. They have to keep on tasting it. This is called clinical experience. The same with teeth whitening. If you just do one a month, which is average in the world, average. If you do one a month, you're an average. If you do 2 a month, you're doing a lot. You're doing that double. So it's average one. I mean, you should go back to the password. If you use your password once a month, you'll forget it. It's the same with teeth whitening. It's just forget all the protocol. You may have to look at the instructions.
The nuances.
Yeah, and then you can start over again. It's all about practice. The more you do, the better you are. I have done 20,000 teeth whitening cases myself. At the height, I was doing like 50 a week, 200 a month. Doing a lot.
And these were high-profile people. I mean, I've seen photos of all the celebrities at your clinic and stuff, and these were not like, I mean, everyone's important, but like you were seeing the people who are like going to be on telly or going to be at a concert the next day, right?
No, I treat everybody the same.
Yeah.
It doesn't matter who they are. They come in, they're all patients of mine. So I treat them exactly the same. My protocol exactly the same. My manners exactly the same. So I charge them exactly the same. So I don't charge people richer more money. Everything got to be transparent. So it's all down to clinical experience. The more you do it, I don't think it matters what you do, which brand you use. The more you use it, the better you're going to get out of the brand. It's just like the wine. The more you're going to get out of it. Then you get to know. The more you taste, then you know which one you like, which brand you like which chateau of wine that you like. It's all down to experience. You have to do a lot of that to find out. Unfortunately, I would say 99.99% of us not doing enough to find out. So we will never find out.
Okay. Well, that's interesting because people are always on about brands, but the protocol, how you apply it, and the experience. So when it comes to occlusion, I talk about the Pareto's principle of occlusion. What's the 20% of things we do in the occlusion world that have the 80% of the result, right? So if I was to ask you, what are 3 things that are so important, because I'm sure there's hundreds, but which are the 3 most important things in the protocol that will yield the average dentist better than average results because they did these 3 things well? Can you give us a flavor of what those 3 things would be? If you had to, like, of all the 100 things, including the brand, including the tray design, including anything part of the lights, no lights, what is the 3 most important features in getting a good whitening result?
Number 1, which is obvious, that because 99.9% of the dentists in the world doing teeth whitening, home whitening I'm talking about, are using bleaching trays. So the bleaching trays got to be amazingly well made and have to be made properly. So please use my trays, it's free. This is number 1.
Okay.
I know that a lot of dentists, because we have a lab called Perfect Trays, I'm doing a bit of advertising here. We make trays for 5,000 dentists in this country. But only 20% of the dentists are using my gel. And they're using other gel, they're very happy. They must be very happy. So as the dental professionals, I always advise my colleagues, always do something that works with you, work on your hands. don't change. If you're happy with something, don't change. Why get outside your comfort zone unless you want to experiment? So I see there 80% of the dentists using my design trays with other whitening brands, and they have no complaints, keep on sending the trays to us. So they must be doing something right. So number one is trays.
So
really
can we expand on that then? Okay, so that, I mean, that was one of the other questions, the trays. So maybe we'll come back to it because I don't want to distract you from the 3 points, but dentists would like to know what is the, the Essex retainer style trays, harder, softer, reservoir, no reservoir. These are some of the bank of questions that everyone sent in. But number one is tray design. Number two?
Number two, you've got to choose what kind of bleach you're going to use. There are many different bleach around. You have carbamide base and you have hydrogen peroxide base. And then you got to, I've been doing teeth whitening for so long that we have to offer a regime to our patients that they can do it. It's no point prescribe something that they can't do it. So we spend time. I think the time is really important. Communication is really important. We need to communicate and find out from the patients. Can you do it? Can you wear the trays overnight? If you can't, then can you do it in the daytime? If you can't do it in the daytime, then what else can we do? So we're going to find out that prescribe something to the patients that they can carry out. It's no point prescribe something to the patient that they cannot do. Totally a waste of time, waste of money, and you won't get a result because the patient is not going to do it. Number two is communication, find out their needs, how to do it. I think that is important.
And like making it practical for them, right? Pragmatic for them.
Easy,
so for example,
user-friendly.
So for example, 99.9% of my aligner cases, if we're doing any whitening in aligners, like as we did get an advantage towards the end, it just makes sense because they're wearing the aligner at overnight anyway, to wear it at night, because it's annoying for them to now take off the aligner one more time, additional to eating and stuff, to do that. And that works for my patients because they're more likely to comply. Their compliance is good. That's an example. Now, for the baby dentists, for the younger colleagues, maybe dental students listening, watching, and I will say, I'm not saying this as an expert, I'm saying it, I will say it, and then you correct me if I'm wrong. Hydrogen peroxide breaks down about half an hour to an hour, and then that's how long you use it for. Carbamide peroxide up to 5 hours, therefore we use carbamide peroxide, slower release at night time, and hydrogen peroxide for that kind of power hour during the day. Anything you want to add to that and correct me?
No, you're correct, and that's why we come to point number three.
Okay, nice.
Okay, it's based on the bleaching time, the contact time. I advocate actually I coined a phrase called conscious bleaching against unconscious bleaching, because a lot of us are giving them 10% carbamide peroxide, which is supposed to be the gold standard according to the ADA, American Dental Association. It's been there for so many years. I think it should be upgraded. And a lot of people are using 16% carbamide peroxide, which is equivalent to 6% hydrogen peroxide, the maximum strength we can use in the UK. I like conscious bleaching because if it hurts you, somebody pinch you, it hurts. Like if you're unconscious doing it at night, you're fast asleep, you only have the pain the next day. And then you talk about over bleaching, and that is very painful. So I prefer daytime bleaching, which the patient in control. If the patient feel anything that is not right, for example, a certain twinge on the nerve, that is over bleach. You stop straight away, take a trace out, wash it off. That's it. You won't have any more pain. So it's conscious bleaching.
Okay. Perfect. So number one, tray design. Number two, make it pragmatic for the patient. Yeah. That involves communication. And number three is conscious bleaching. I've never heard of that. I've heard of conscious eating.
Bleaching.
But now we have conscious bleaching.
Not unconscious.
Has to be conscious. Okay, great. Niki, anything from you before I carry on with more questions?
No, it's just mainly the thing was, again, with the different gels that you have, Dr. Chan, I think one thing that you forgot to probably mention was the fact that you've got a dual barrel action. So the gel is only activated once you push it through the plunger. So, I mean, Dr. Chan probably will explain that his gels have a patented activator in them, double-barreled. So it's only activated once you push it through.
It's like a metal primer with an A and B bottle that only gets... okay, interesting. I didn't know that. Okay.
And I thought that... So I've used Dr. Chan's gels. I've only been in contact with Dr. Chan for 2 months. I've done 5 patients using hydrogen peroxide daytime bleaching. And for the first time, I have had 0 sensitivity. I actually asked them, I want to know, even if you feel a twinge at any time, 0, nothing. So one of the main reasons Dr. Chan is so popular is because he does tooth whitening painless.
So that's your second patent then, is it? That gel activator. Is that the second? You had the first patent with the trademark?
No, in fact, I have 15 patents.
Okay. All whitening related?
Whitening and some other things.
Love it. Okay. So
mainly in dentistry.
Okay, great. Well, let's on the topic of sensitivity then, right? Well, I've got a couple of questions. One, you talk about concentrations, percentages. Let's just tackle that first before we go to the big one, which is sensitivity. Let's say you are anywhere in the world. It doesn't have to be UK. Because obviously we in the UK, EU, we have the issue of the maximum concentration being 6% hydrogen peroxide, or is they say 16, but technically is it 18%? Because if they
16.67.
I love it. Okay, 16 and 2/3% carbamide peroxide, which breaks down into 6% hydrogen peroxide and urea and water.
Urea and water.
Okay, good.
No, urea and hydrogen peroxide. Carbamide peroxide.
Yes, fine.
Urea and hydrogen peroxide. Yeah.
That's the one. Okay, fine. So, but we do that because we're here and there's these rules, but when you do whitening in other parts of the world, or you had free reign and you had to make the rules again, would you keep the existing rules or would you change it because you feel in that conscious whitening for that 1 hour a day, you would want the patient to have a higher concentration of gel?
I would like to have a high concentration of gel because I'm an inventor. I invented all the gel myself, the formula. So because I've spent a lot of time doing in research, I have many different type concentrations, carbamide peroxide, hydrogen peroxide. The best gel, the really best gel, I mean, it's so magical. It's 10% hydrogen peroxide. Unfortunately, we cannot use it in the UK. That's why the reason I left UK because of that.
Wow.
I was so upset and so disappointed. I cannot use my best invention. So I have to take it somewhere else. And let someone else can use my best invention.
I can totally relate to that because if tomorrow they said in the UK we're not allowed this specific type of rubber dam that I like, I would move country as well.
We all have something, right?
What's yours, Niki? What is it that if they removed it tomorrow you would move country for?
Oh God, what would I move country for? It'd be something sports related, definitely. There, something to do with cricket. If they got rid of something like from TV or something, I'll be gone.
Fair dues. Okay, so that answers that 10% hydrogen peroxide. And you're the expert. We'll take your word for it. But sensitivity. That's one thing that I'm sure 80% of the questions asked you are regarding this. It's the number one complication.
It is
for teeth whitening. And so, what should we know? You have the floor. Everyone's really interested in your expert advice here. How can we ensure that our patients have their teeth whitening as comfortable as possible? Because if it's comfortable, the compliance will be better. The results will therefore be better, and they won't be like what we do. As colleagues is, if you get sensitive, do 1 day on, 1 day off, or you rub this toothpaste in, and all sorts of advice we give. I don't know which of these advice is appropriate. Like because you just said sensitivity wasn't happening in your patients. Maybe you will tell me that if the patients are feeling sensitivity, then maybe what we're doing is actually wrong. Maybe you're saying 0 sensitivity. I'd be surprised if you say that, but maybe that is the proper way. So I'm actually genuinely interested. Sensitivity, I want your take on it.
It can be 0 sensitivity, but it needs a lot of experience. But to make it minimal, really the sensitivity is so minimal, is go back to the 3 things. Number 1 is the tray design, really important. The tray design, you see my tray design with a little dimple, that is really, you only need a tiny bit of gel. That's all you need.
So they're called like dosing dots or reservoirs, also same things, right?
Same thing, which is my invention. Everybody copies it. Good luck. I don't mind, I like to share.
Okay.
Yeah, just credit Dr. Wyman Chan in the future.
Yes, of course, absolutely. You heard it here first, guys. If you're using these dosing dots, you have this man here to thank.
And also the seal as well. You score the model. All those helps. That's number one.
And then
Because
people market it as super seal and all these kind of things.
It's super
Why don't
seal.
you sue all these guys?
now, why not you sue? I want to share.
Good. I knew you'd say that. That's why
No,
I wanted to get
share
out. Okay.
because, in fact, another company asked me to sue another company. Whitening. I said, why would I want to do that? I want to share.
Yeah.
I say, I'd like to, because you stole it initially, and then I make a complaint, and then you stop using it. Now someone is using it, so I say I don't complain anymore. Everyone is using it. What's the point of complaining? So just use it. It's wonderful. Number one is the trace, really important. Number two, conscious bleaching. Because if you wear the trace, go to sleep. You're asleep, it hurts you already in your sleep. By the time you wake up, it's too late. It's painful because what it hurts is over bleaching. It's the gel, as a peroxide, got to the pulp and cause pulpal inflammation.
Doesn't that happen anyway? Isn't that supposed to happen in about 15 minutes? The gel will reach the pulp.
Well, it depends how much pulpal inflammation you're gonna have.
Okay.
If you do conscious bleaching, you know it straight away because you feel it. Then you stop. You remove everything. You just stop and rinse your mouth out. If you're asleep, you don't know what's going on. It's been hurting your pulp for so long, maybe 4 hours, maybe 6 hours.
So what you're suggesting
Conscious
is,
bleaching.
with conscious bleaching, if someone's doing it during the day and 20 minutes later they start to feel something,
Take it out
take
straight
it
away.
out, and then that's day one done of whitening. Is that what you
Day
mean?
one done.
Oh wow.
So the next day, do 18 minutes.
Okay, perfect.
Yeah, because it hurts you at 20 minutes, you do less than 20 minutes.
This is great because you read the packet. It says half an hour to an hour,
It
and,
is.
and then that's what you give to everyone.
No, it hurts them means the bleach has got to the pulp. That's why it hurts. That's like a simple, it's all about diffusion. Like not too much science, a little bit of science, diffusion. If you paint a gel on the teeth, on the surface of the teeth, it takes time to diffuse all the way through the enamel to the dentine, and it gets to the pulp. It will get to the pulp. A little bit get to the pulp, it's not going to hurt you. A lot of the bleach get to the pulp, it's going to hurt and very painful. That's why I'm an advocate of conscious bleaching. Do it consciously. When it hurts you, take it out straight away and look at, I've done it 30 minutes. So next time, I can guarantee you do it for 29 and a half, it will not hurt you. It's just a little bit, it get to the pulp, it hurts. So you can adjust your time. So if it doesn't hurt you the next day, you can increase a little bit more time, you get a better result. So you just play with the time. To the dentist, that's why I advise my patients who want to be safe, start with a short time, maybe 15 minutes. It doesn't hurt you. The next few days, go into 20, the next few days, 25, 30. Just
Progressive.
Yeah, just use the highest concentration you have. Why use 3%? Why use, if you can use the 6%, it's the same price. I couldn't understand why dentists buying 10% instead of the 16% copper pipe or the hydrogen peroxide, 6% instead of 3%. You pay the same price. Why not get to 6%?
Okay, and just modify the time.
Hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I want to do is create a really supportive environment that's not like the environment we have on Facebook, and it's built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wide wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz, like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you do make an account on Android, iOS. If you make it on the website, you get access to the free trial, and you get our best price if you sign up through protrusive.app. So our best deals and free trials are only on protrusive.app. Of course, we always put the link below in the description, and thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode.
Modify the time, you get a much better result.
Okay, that makes sense. But here's the thing, right? So let's say I put in my whitening gel, like I've whitened before, and then get sensitivity. So are you saying that I've over bleached?
Over bleached, yes.
So even the next that evening, let's say I whitened during the day. That evening I drink some cold water. I feel it in my tooth like hours later. Is because I over bleached?
Yes, over bleach. Yes.
Okay.
It's a powerful inflammation.
Mm-hmm. Okay. Well,
it's different from dentin hypersensitivity. Totally different.
Okay, and then so over bleaching is the formula of over bleaching is time to too much time, potentially too much concentration. Okay, if you've done that. Oh, sorry, I remembered my trail of thought now. So what are the dental features that you can look at and you're going to warn that patient extra? For example, if the patient's got deep caries, I will say to them, look, I'm warning you that you may need a root canal because you have deep caries, whereas I wouldn't really emphasize so much if they have a small carious lesion. When it comes to the whitening, what are the features that you're looking for? Thin enamel, for example, or micro cracks in teeth, for example. Are these all things that you may say to a patient, actually, because of these features that you present with, your bleaching time will be less? Can you give us shed some light on that?
Yeah, I think the anatomy of the tooth is very, very important, and the amount of enamel over the dentin is important. If we have a abrasion cavity at the cervical margin, you can expose dentin. If you put gel in those area, it can get to the pulp in no time because dentin are a lot more porous than enamel. It just goes straight to the pulp and it hurts within a minute or two. So we avoid applying gel on the exposed dentin, or maybe best just to seal the tubules, open tubules or the exposed dentin first before using some GI. That's what I normally do. You don't have to do
like class 5 restoration with GI.
No,
yeah?
just you don't have to fill it. Just a thin layer, just to block the tubules.
Okay.
So that and then you can apply gel over because you can do it by accident. So if you put on enamel, usually the pain is not there. Enamel is very thick and very, very dense. Yes, if the patient may feel sensitivity, if we do it, that's why I always advocate conscious bleaching. If you do it consciously, the patient will know, oh, I'll do it for less time. It's only once they feel it. And it's not painful. It's only a tiny pinch, not painful. Okay. If you do it overnight, it can be very painful because you've been over bleached for so long that you do not know. Because you fall asleep, you do not know. Because the pain is very mild and only get stronger and stronger as the inflammation in the pulp, because nowhere to go expand. That's why they get really painful.
Why is it that, I have some patients and their teeth look virtually the same to me, like it's very similar, but one will come back saying she's had an absolute nightmare, like the teeth are way too sensitive, and let's say they both did it for 1 hour or half an hour, and let's say we're over bleaching, for one person, obviously, because they're getting sensitivity, but the other person comes back saying, is this even working? Like, my teeth are whiter, but you warned me so much, Jazz, but I'm not getting any sensitivity. Do we understand the pathophysiology of it to a degree of why is it that some people will get it more than others when they might, it's not obvious exposed dentine or those factors?
Yes, in fact, this was my PhD thesis. Yeah, probably you read my thesis somewhere. Yes, it is. It depends on the porosity, the density of the enamel, because we cannot tell. I devised a way that we can tell the porosity and the density. That's what I taught now in China. I used to teach this here. Must be over 5,000 dentists. Probably everyone forgotten what I taught them. So hopefully go back to the notes. I gave them notes. It's just look at the porosity and the density. The process is very simple. So I don't want to go into that today because I charge for that course.
Sure, no, I appreciate that. No, I think
it can get easily distinguish.
Okay, fine. So the porosity,
and
so something when we're looking at our eyes, they look the same. But the porosity is once you discover the porosity, is you can predict.
That's right. You got to do some, I would say, just do a little bit of work to find out. Do a little bit of work to find out. It's very, very easy. I taught that many years ago here.
And patients, do you recommend any special toothpaste or desensitizing agents for your patients?
I never use that.
Wow.
Never use that. I never use desensitizer. I never use any. Because if you do conscious bleaching, you don't need them. You will need them when you do unconscious bleaching. Please do your bleaching consciously from now on. It's the same thing.
Because that was like a huge question in the community. Is okay, which products, which desensitizing agents should I use? Should I use Pro Relief? Should I use this one? Whatever.
I don't use any.
I love that. Excellent. Well, I'm going to take a moment.
Can I just say one thing? I mean, a funny thing is, like, when Dr. Chan is the first person who introduced me to treatment planning for whitening. According to me, whitening was simply taking impressions on people who wanted whitening, get the trays made, give them the bleach. Hope I see you in 3 weeks in the teeth. Dr. Chan runs a treatment planning service for whitening cases. How many cases is it that you've done now in China, Dr. Chan? That you've
about 10,000 cases. Just like Invisalign, a treatment plan in China.
And there is a plan because there's a sequence, and every case is different, and there's protocols.
Every case is different, and then we refine them. Like aligners. If something is not going right, we refine them as we go along. So there's lots of refinements.
It was just a wonderful concept that treatment planning and whitening. So I've seen pictures from dentists coming from China where Dr. Chan will tell them step by step. Okay, you need to use 6% there. Okay, we need to calm down in this area. Use 8% here. It's amazing. Something I'd never thought was even something that we did in.
I think it's great you mentioned that, Niki, because I remember being a foundation dentist and I was telling, because you're right, at an undergraduate level, we don't get taught whitening. So I remember going to my foundation trainer, like 1 or 2 months into it, saying, look, I think I need to go to a whitening course. Do you think I should go? And this was when you left the UK, yeah? So this is when you left the UK, and he laughed at me. He says, it's just whitening. He's like, just make some trays and get some gel in there. So there's a culture, there's a thing that is easy. But actually, there's so many nuances, right? There's so many nuances, and you're right about the treatment planning. I've got we've got how much?
Can I add on to you?
Please.
I think that is for research, looking at the porosity, density. But everyday life, you don't have to do that because it's cumbersome. It takes a lot of time and a lot of chairside time to assess the porosity, density of enamel. But just use what I just said, conscious bleaching. That's all you need, and the trays, that's all you need. And then just adjust the time accordingly because it's really cumbersome. It's not easy. And you've got to be able to recognize it. And just like drinking wine again, you've got to practice and practice and practice. Otherwise, in front of your eyes, you can't even know. You don't know what you're looking at. So
I think if you drink enough wine, you won't be able to see what you're looking at.
Stick to something simple. My trays and conscious bleaching. That's it, and adjust the time accordingly. You can do it really very comfortable for your patients. Yeah, don't go into too much the details because that is complicated and take up a lot of chairside time.
I'm so excited to get this out to the community, by the way. This is already so many gems in there. Dr. Esther Mateo, hello, Dr. Esther from Protrusive community. Is it true that patients should try a white diet when having treatment?
I heard of that when I was started bleaching 30 years ago. After I done my PhD, it's not necessary. I'm a coffee drinker. I'm a red wine drinker. Look at my teeth. Look at my teeth. They're beautifully white. OM3. You don't have to. If you know the science, I don't want. Let me go a little bit into the science then, if you don't mind. When we bleach the tooth, make it white, it's the color of the dentine that reflects through a translucent enamel that we're seeing the color of the tooth. And dentine is usually darker yellow in color. So to make the tooth white, you have to bleach the dentine white. Once you bleach the dentine white, doesn't matter whatever you drink and eat. No, it doesn't matter what you drink and eat. It's absolutely no factor. What you have to just wait for the pellicle layers to come back. Maybe take about 5 minutes. If you want to come back faster, have some chewing gum and come back in a minute. That's it. Well, you can have a cup of black coffee, a glass of red wine, a minute after you do your bleaching.
Well, I've seen this advice about try a white diet on like magazines and stuff, so it's all BS. However, on courses for whitening or on aligner courses where someone also wants to give some whitening advice, it has been said by educators that for 2 hours after whitening, avoid anything brown, avoid anything staining. Is that true or is that false?
Scientifically, it doesn't make sense. I can't say it's false or true, but some company actually advocate that 2 hours, no color food, and some company actually saying that for the whole course of bleaching, while you're doing the bleaching, you only can have white food.
So what does Wyman Chan do?
No restriction.
Zero.
I love it.
You can eat and drink whatever you want. No restriction.
Just give it 1 minute.
Yeah. No, I think to be safe, 10 minutes for the pellicle layers to form a thick layer on enamel.
Perfect. This is going to be a tricky scenario that we face. Okay, so non-mitral teeth. Let's say you have like a single central, which is a bit more yellow, black. And I appreciate that. That's a very significant detail. You can't be blasé about it because the protocol will be different. But the crux of it is, this is from Ian. Thank you, Dr. Humphreys, for this question. How best to proceed with non-vital whitening when the patient also wants the other teeth whitening? So for example, when I have such cases, I've done it before where I get my target tooth whiter and maybe slightly whiter than the rest, and then I start the whitening all the others. Whereas other people say, just do them all at once. What, in your experience, works best as a rule of thumb? Because I appreciate that, just like back to your point, Niki, that actually everything needs treatment planning. But to make it generic, is there a specific way that you recommend to approach this?
A single discolored tooth is a discolored tooth. And the less discolored tooth, also discolored tooth. So normally I teach, just do it at the same time.
Okay.
The more discolored tooth will whiten, will bleach faster. The whiter teeth will bleach slower. They will catch up. I haven't seen a case that hasn't catch up. I've done a lot of cases. They're all at the same time, they are all external bleaching. I don't do internal bleaching anymore.
Say that again in case someone missed it. So
I don't do internal bleaching anymore. There's no need for internal bleaching.
This was the gem I was waiting for.
This is pretty cool. Okay, as someone who has done I've got some great photos I can show you internal bleaching cases, and I'm very proud of them because you said show your bad case, show your good case. Now for the visual feature of this podcast, we'll do that. But I'm amazed. So we'll save that for the visual podcast, so make sure you guys tune in to that one as well.
I'll show you some amazing cases.
Yeah, without having to actually open up the access cavity again. That's fascinating. Okay, cool. So
where it becomes even more useful is where where it becomes even more useful is your dark tooth that hasn't had endo.
No
calcific metamorphosis.
Yes, exactly. That's where it becomes really useful, because an endo tooth already has a cavity at the back of the tooth there. So walking bleach technique, you can do that. But there are dentists out there who are advocating for those dark teeth to do endo and then walking bleach technique. You don't need to do that anymore.
Okay.
Now, I used to do internal bleaching. I got very good result. I learned that, but then I started experimenting because it's very technique sensitive doing internal bleaching. Really technique sensitive, and also taking up a lot of chair time.
But also it can be iatrogenic because every time you open up an ass cavity, can you guarantee that you're not removing some more dentine, some more enamel? You know, you will be scratching a little bit, right?
Absolutely.
That I'm not a restorative dentist, so I'm just look at the bleaching side. But now I just offer another alternative way of bleaching that too. I think we are so lucky to be a dentist. We can do certain things in so many ways, really many ways of doing certain things. So I just add another option to the dentist to choose. If they love internal bleaching, please do them.
Well, it's also something like for some reason, obviously we're going to talk about it in the next episode, but for some reason they're not getting the result that they usually get from when they do the axe cavity, do the internal. They still have that option to go inside, but if you start outside, there's more minimal. It just makes a lot of sense to me.
It's non-invasive.
Yeah, I mean, why not? I mean, with non-invasive and chair time, it makes
chair
so
time
much
is
golden.
because I don't have to drill anymore. I can't do internal my bleaching because This is because I give myself restriction. I have no drills in my clinic. Absolutely no drills.
There we are.
How can I do internal?
That's the proof.
How can I
He's
do
not
internal
secretly
bleaching?
running. This man doesn't even own a handpiece.
I don't own a handpiece. I don't have a handpiece. Fast and slow.
massage chairs.
Fast and slow. I don't have a handpiece.
Excellent. Peroxide allergy, is it a real thing and how common is it?
I came across that on a couple of my patients. They claim that they're allergic to peroxide, so I send them to the hospital, and then they've done a lot of tests. So it happens to be the makeup they just bought a week before. So
They what, sorry?
it's a makeup they bought a week before.
It's the makeup, cosmetic thing.
Cosmetic thing. I read a lot of literatures. There's no proof that peroxide gives us an allergic reaction. The reason is that because peroxide is not a foreign substance. We produce it in our body. If we're allergic to peroxide, we'll be in real trouble.
Well, I have a patient who we tried whitening for her, and then she started to say her lips started to swell. Her lips were swelling. What do you think was going on there?
For example, if you use 16% carbamide peroxide, what's the other 84%?
It's 84%. What's the other 84%? Okay. So it's not the peroxide. It's what else is in that gel that's causing it. Okay. What do we know of any common agent that?
No. We do not know because no research is done in that field. No. But to come really to prove it's allergic by peroxide, there's none. The literature there are hundreds of thousands, is none.
Okay. So if that's happening, maybe changing the brand of the whitening may be a fix. And also the hospital, the true test.
Yeah.
And because we're cosmetic.
Always send them to the hospital to do some testing with the product as well. They can test it out.
Yeah. Okay. Perfect.
Quite similar to sort of patients saying they're allergic to adrenaline and the anaesthetic there. But there are some patients who are adamant that they are allergic to adrenaline.
That's true. That's a good point, actually. Very similar. Okay, we have some questions about light, which I'll come to. There's also some questions about, more about sensitivity. Okay, tetracycline staining. I have read some guidelines that it's a 3 to 6 month worth of whitening treatment. Is that something that is predictable? Is this something that you've treated before with success? And any tips you want to give to dentists who want to not do veneers and crowns on these tetracycline staining teeth and they want to use whitening?
I think probably wait for the visual. If I ever say anything now, you will not believe it.
Wow. Okay. So even more excitement for the visual episode.
Seeing is believing. I mean, tetracycline teeth, they are the stain on the dentine, mainly on the dentine, because we take the tetracycline antibiotics into the bloodstream and then they get to the pulp, and then it affects when the dentine is forming, it affects the dentine formation. If we take it earlier, it can affect the enamel as well. So it depends on the age. It's just bleaching. It's discolored tooth. If you got a good protocol, it works. Like I can show you some cases, just 2 weeks. It's amazing result we get from a C4 to B1, just 2 weeks.
2 weeks.
2 weeks.
2 weeks,
weeks.
for tetracycline staining.
Yeah. And then we have amazing result 4 weeks.
All right, let's wait for the visual
Yeah.
one, guys. So you guys have to tune into that. That's
Jazz,
fantastic.
just one thing about
Yeah.
tetracycline staining, because first thing I asked Dr. Chan was about sort of tough cases, tetracycline staining, but something Dr. Chan told me that's very poignant. In 13 years, I've seen 2 tetracycline cases in my whole 13 years. This was a problem that was in the 70s and 80s and 90s when there was a lot of tetracycline antibiotics being taken, and a massive problem in the Far East. So in China, where Dr. Chan practices and teaches there, that's still a massive problem. But that even then, because the younger generation now, they've not been exposed to tetracycline. So it's a very rare thing that we're going to get tetracycline staining, especially this side of the world.
Yeah, it's very rare in the West now. It was we started prescribing tetracycline in 1965. And then we stopped in 75 because we dentists discover a group of children got very discolored teeth and banded as well. And then the doctors, the GP started tracing back, and everyone had tetracycline.
One day it will be like in a textbook that the once upon a time there was COVID, once upon a time there was tetracycline staining.
Yes, it is, yeah.
I was saying our kids are going to learn about COVID in history books like we learned about the Cold War.
And we'll learn about tetracycline in the dental history books as well. Okay, the last question I have then, before we then take a break and we pivot into the visual one, which I'm very excited for, especially with the tetracycline, is all to do with light. So, when I qualified as a dentist, there was this various brands that had the lamp, that whether it was heat or whether it was light or photo initiated, all these things, and then coinciding with a time where the legislation changed and now you can only use a certain percentage, like almost vanished. And so is like what I've heard is that light is a gimmick. What I've heard is that light is just marketing, and there's no science about it. Even the warming is not so significant. So I guess what I want to know is, do you use photo initiation or light as part of your protocols?
Are we talking about in-office bleaching here?
Yes.
I don't do in-office.
Okay. So
I don't use light.
Is it in office, even like when you're consulting dentists, you're giving them advice, like they start a new clinic and they say to you, hey, I want to start offering whitening. Should I even include in office as a treatment modality? And it sounds like you're going to say no, but why is that? Why do you not offer it yourself?
I would say no, because it takes up so much chairside time. It's really not worth it. You got to charge so much money for your chairside time. It's how much can you charge? So it's not how I say it's not profitable. It doesn't make sense, and it's very technique sensitive. The sensitivity is from chairside. There's a lot of things can happen at the chairside. I don't want to go into it. A lot of things can happen. The pain was created during the chairside treatment, not home. So avoid that.
It did make sense, and then therefore we don't need those lamps.
You don't need to do chairside. Especially, I'm so pleased with the new regulations. We can only use 6%, so we can get rid of the chairside. We don't need chairside, and it's very. In those other countries, can use 40%. It's so risky. I mean, in Singapore
when I was there, we were using higher percentages.
Look at the damage is done on those accidents. You really are talking about massive damage, burning gums, burning lips, and gums peel off. It's not worth it. Just not worth it.
But then, as part of your protocols, when they take the gel home and they're in your trays, is there? And I learned that yes, the gel's very fresh because it's got the activator. But is any form of light therapy used in your whitening protocols?
No, we don't use light.
Listen, if Wyman Chan's not using light, do you need to use light, doctor? I want you to really look in the mirror and reflect on that point, guys. For anyone who has any question about light, okay, because the man has just spoken, right? Now, before we wrap this up, I want to ask about, is it okay if I ask about Magic 3? Is there something you want to go into?
Of course, yeah.
Right, so Niki's showed me some images of inflammation or inflamed gums, abscesses managed using a gel formulation containing peroxide, and it was like, it looked amazing, okay? And so you are the inventor of this?
Yes, I'm inventor, yes. Yeah.
Tell me about like what the problem was that you faced. What was the problem that you thought, okay, we need some sort of solution. What problem are you solving with this? And where is the journey in this product development so far?
Okay, I spent a lot of time in China. I'm working with one of the group practices, which is mainly an orthodontic based practices, and they have about 25 clinics. And they do a lot of clear aligners and some fixed as well. A lot of clear aligners. They're very good. A lot of them are PhD and professors in Peking University. And I worked with them. And initially, I didn't see a lot of children. But then, as we get closer, get and be a bit friendly with the orthodontist, and then they came to me, say that, and show me some cases. I said they have this problem, which is the white patches. And white patches, and then they show me that the children, even though how well they motivate them to do good oral hygiene, and they just can't do it. Children are children. They just can't manage the good oral hygiene, especially with fixed braces. And that's when one of the professors actually, when we were talking, we spent lots of hours drinking and talking and
red
wine, definitely red wine, yeah. And then we actually spend hours on what we can bring and what we can help the population. And then he come up and say, we got all this problem with plaque control. He said, can you say mechanical cleaning is difficult? Can you make something chemical so that to help them with oral hygiene? So I say, oh, okay, because I look at, because I've done a lot of work, I know plaque control, I love, because those cases, especially when you see those cases, you don't get results, there are a lot of plaque on the teeth. The bleachers couldn't get to the teeth. So these are the cases you don't get good results. So that's why I always very keen in plaque control. Make sure that the teeth that I'm going to bleach is plaque free. If they're full of plaque, they're not going to work. They're going to consume the peroxide, and it's all wasted. And that's when I started looking into it. And what I have, my formulation I have is all too strong. I mean, burn gums, all those. So I come up with Magic 3. Magic 3 is 3% hydrogen peroxide base, and I modified the formula. Then I actually make it into a medical device, a class 1, so that everyone can use it. Under 18 can use it.
Under 18, okay.
Yeah, because it's a medical device, class 1. It's registered. And
Congrats.
yeah, when I make this product, I send it to the MHRA. They say they have no such thing. So because I say this is a colorless plaque indicator, remove plaque at the same time, also reduces gingival inflammation. They said we have nothing like that. So they refer me to an organization called GMDN, to Global Medical Device Nomenclature. So I went there, I joined the members, I say I got these products, I want to register as a class 1, but the MHRA say they haven't got such products. I say no problem, we're going to look at it and we're going to give you a new number. And then you apply, and we did. It took us 2 months. They actually make a new number for us.
Okay, sweet.
Yeah, so it's brand new. It's innovation. So we got a class 1 in this country. I got a class 1 in China as well. So it is amazing. It is a colorless plaque indicator. Have you heard of something so ridiculous before?
No.
Colorless plaque indicator.
No.
And
So the traditional plaque indicator, bright pink, bright purple.
Exactly. So you see, the way I look at it is that it's not only indicate plaque, colorless, and it's also remove plaque at the same time. So the reason I brought this up, I thought about it for about a couple of years to bring this up. So I look at the traditional plaque indicator. They're all colored, and the mixtures of this disclosing material with the plaque or bacteria or the plaque itself and produce color. And then we have to use mechanical means to remove them. To me, I think you give them poison and then you give them antidote. That's not on. See, and that's why we do not. I mean, how can we charge patients by discolor the teeth and then remove the color and charge them? I think that's not right. So then I come up with a colorless. It's effervescent. It produces effervescence.
So that's how it indicates. Its indication is not through color, but through fizzing.
Fizzing, bubble, a lot of bubble. I can show you some visual. At the same time, when it bubbles, it breaks down the plaque. It's gone. And at the same time, it reduces gingival inflammation because all the anaerobic bacteria is gone. Actually, we put it in the sulcus, we apply, and I'll show you some cases. Amazing, just 10 minutes, inflammation just disappear. 10 minutes, gone.
Now, what I'm saying in my head, because I want to challenge, I want to question, right? I'm remembering Professor Zilsa Shaw from uni, Sheffield. She used to say to me that, I know it's not a mouthwash, but she used to say, it's like when you go to the car wash, no matter how much solution, chemicals they use, until they get the elbow grease, until they get the sponge, and they mechanically clean your car, it will be super clean. So it won't be super clean until you get the mechanical. Is this solution a substitute for mechanical plaque removal?
It's his substitute for mechanical cleaning. To me, there's no need to do polishing anymore. No need to do.
Does anyone need to brush their teeth anymore?
If they use it every day, they don't need to brush their teeth.
But that would be an expensive thing to do, right?
Very expensive. Yes, they can do it. And it's very expensive. Really expensive.
Dr. Shen, that's what you use, right?
Yeah.
Magic 3 on yourself. Or...
Yeah, so you can use it, but it's very, very expensive because the product is expensive. But I'll still.
So what problems are you solving then?
I'm solving that with children. They cannot brush their teeth properly.
And thus they will not get white spot lesions because the oral hygiene is improved because you're making it easy for this uncompliant or difficult population who struggle, and then the elderly as well, I imagine.
The elderly and in fact everyone.
Everyone, yeah.
Everyone. Those people who doesn't like brushing their teeth, basically. And especially if we have any gingival inflammation, and that's and the reason why the patient do not brush their teeth with the gingival inflammation, because it bleeds. They're too scared to brush. So if you can get rid of the bleeding and show them that oral hygiene is still important. I don't want them to use the Magic 3 every day, maybe once a week, once a month, and go to see the dentist every 3 to 6 months. Just a prophylaxis. As far as Magic 3, it's just a prophylaxis system.
So it's like those anxious patients, right? They haven't been to the dentist in years, and then to even go near them, if they use a gel to get their bacterial load lower, and then less pain when they're actually having the mechanical means. Is that what you had in mind as well? Yeah?
It's no pain. It's no mechanical means. That means we can remove plaque, no noise, no vibration. I think to the dentist, across
for anxious patients, that's amazing.
No aerosol.
Yeah.
It's a no-brainer.
So next pandemic.
Dr. Chan never shot during the pandemic. Didn't have to.
No aerosol. So it is, and it's not only just remove plaque. It's remove plaque chemically, so we don't have to use mechanical means. It dissolves the plaque away. Probably seen a lot of chemical dissolve the stains away. Similar stuff, just dissolve the plaque away. It's just use the water to just 3-in-1 water. Just wash it. It's nice. The teeth. For the first time, you will see your patient's teeth shines. They shine. They're shiny.
But I mean, if they're using it for 10 minutes, then it's not there to whiten the teeth at all. It's for biofilm removal.
Biofilm
and
removal.
Inflammation. And Niki, you told me abscesses. That's an interesting one. Tell me about that.
Pericoronitis, abscess.
Pericoronitis makes sense.
Pericoronitis, totally.
A lot of sense. But abscesses.
It kills germs. It's anaerobic germs. When you get rid of the germs, you can reduce the inflammation. Mainly, it's to reduce the inflammation.
Okay.
Gingival. We're not talking about periodontal. We're just gingival.
Okay, fine. And in terms of evidence base, where are we at now? Because obviously it's a new product. Where are we at now in terms of the future, in terms of evidence base?
Evidence base. I'm a clinician, so I think the best evidence to show a lot of cases.
Case studies.
I think if you don't do it yourself, see it in front of all eyes, you can read hundreds of papers, you still don't believe it. You actually need to do it, try it. If it doesn't work, just say, well, okay, I've been cheated. If it works, wow, to say it works.
I mean, Niki showed me his own cases, so I'm very interested in this. When do you think this will be available in the UK?
It's available now. It's available. So I launched that. I actually launched that in Shanghai about a year ago, which is a show, and then I launched that in Dubai.
Okay.
And then and now we're going to launch this in London in the dental show, dentistry show.
You heard it here first in Tyler's Reading.
Yeah, we're going to do live demo. Please come and see us and be a model as well. And if you have any gum inflammation, come and see us. We get rid of them for you. I mean, gingival inflammation.
Amazing. Well, how can we find out more? Like, obviously, at the Dentistry Show, have you got like a website or more information, anything you want to basically, because we have a very curious, geeky community, or just say wait till October, or in the future I can add the links, or...
Yeah, wait till October, just come and see us. You won't miss us. It's going to be a big crowd.
Amazing.
And you'll be able to see it live. You'll be able to see Magic 3 treatments being done live. If you want to be a model, by all means, let us know, and you can come and get it done yourself there. We'll be also presenting sort of the different uses of Magic 3 while the dentist or patient is having the Magic 3 treatment done. So the funny thing is, I've been using it for 5 weeks in my practice in Romford. I started off just by telling people, look, I'm going to do your cleaning a different way without torturing you. I'm still charging you Bantu, nothing else.
Mm-hmm.
But if you like it, tell all your friends. 3 weeks after doing that, we had people come into our reception saying, I want a hygiene done, but I want the magic treatment. I want the magic treatment. My receptionist was not clued on at the time. She said, we're a dental practice, we're not a magic centre. And then my other dental nurse had come out and said, no, that is for treatment that Dr. Shah is doing there. So we haven't made it sort of common knowledge that it's available. Really, the Dentistry Show is when we're going to make it available for everyone.
Well,
but it is available now.
Thanks for allowing this podcast to be the first one to talk about it.
Amazing community, definitely. They deserve it, they do.
Okay, awesome. Well, I'll put, when you do have more links available, I'll add them in the future, obviously, as we build on content. But I look forward to hopefully seeing you in the Dentistry Show to actually see it in action. I know you probably got some we'll talk about the video stuff. But anyway, you have to join us, guys. You have to join us in the video segment of this podcast. Okay, so this one was for anyone on Spotify, Apple, and obviously community on Protrusive Guidance and YouTube to listen into. But the next one is not amenable to Spotify or Apple or audio. Next one's going to be very visual. I will show you the case of like a common problem I've seen whereby the incisal haft is grey. Like, is this amenable to whitening? And I will show you a case that I think a patient lied to me. And I will show you that I think she was telling me she's whitening, but she wasn't whitening, okay? And you tell me if you agree. So if you want that, guys, you stick around for part 2 of this must listen to, must watch episode. Niki and Wyman, thanks so much for this one. Catch you in the next one.
Thank you.
Well, there we have it, guys. Thank you so much for listening all the way to the end. Thank you also for our guest, Niki Shah, for helping to arrange this and supporting and helping Wyman Chan with the Magic 3 launch. Before I talk more about that again, you can get CE or CPD credits for this episode. We are a PACE-approved education provider. If you're watching this on the app, scroll down below, answer the quiz, claim your CPD. And if you're watching on YouTube or listening on Spotify, get yourself on the app. Come on. Especially if you listen to all the episodes, you can rake in 52 new hours of CE every year. That's just the new CE, not even including the master classes and the old episodes. So you've been a long time lurker. It's time to finally say hello to your community at protrusive.app. Hope you enjoyed this particular episode asking all of our whitening questions. You can get involved, right? Like when you're like on the community, we give you opportunities to ask questions to our guests, just like today's episode. Now, don't forget, if you're interested in Magic 3, which has really piqued my interest, head over to protrusive.co.uk/magic3. There's a special promotion for October and there's an ongoing discount just for Protrusive members. So to take advantage of that is protrusive.co.uk/magic3. I'll also post it on the centric relationships section of the app so you don't miss out. Thanks again, my friends. I'll catch you same time, same place next week. Bye for now.